Let's take a look at some of the latest health headlines.
Joining us now is our good pal, professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Good to see you.
Good morning.
All right, we are going to start with the first over-the-counter birth control pill getting
Yes.
FDA approval.
Coming soon to a pharmacy near you.
Yeah.
This is long overdue. I mean, the gynecologic community has wanted this for at least 10 years. And the reason for the delay, quite frankly, has been political, not medical. And in fact, over-the-counter birth control pills have been available in over 100 countries worldwide, and they have no more side effects than we do. So the pill is called Opill, and it's a little bit different than the traditional pill that has both estrogen and a progestogen component. This just has progestogen, which is good because it makes it a little safer. There's no increased risk of blood clots. The downside, maybe a little more breakthrough bleeding, and you have to be really, really consistent as far as taking it. You cannot miss any, otherwise you might have an inadvertent pregnancy. The big question, what is this pill going to cost? Everyone is talking to the manufacturer saying it's great that it's going to be more available, but you also need to make it affordable. But there is no information yet on cost, but they are promising to make it affordable. But you know, affordable for them may not be affordable for the general world.
Yeah.
But we'll see, but it's good. It's a good thing.
All right, a new study about hormone therapy and Alzheimer's disease.
So dementia, of course, is common as people age, and Alzheimer's is the most common form of dementia. The risk factors being age, family history, and being a woman. Women are 2 times as likely as men, and we know that there is some kind of an association with estrogen. But the question is, when it comes to menopausal hormone therapy, is estrogen therapy going to increase the risk, decrease the risk, or have no impact? And former studies have shown that if you start hormone therapy older, over the age of 65, it will increase the risk. But if you start younger, as you first go through menopause, it actually may decrease the risk. But a big study that was released a couple of weeks ago upended all of this. It was a huge Danish study that said basically there's a 27% increased risk in Alzheimer's if you take hormone therapy. And this caused a lot of concern, a lot of anxiety, and a lot of anger. Bottom line is an analysis of this study showed that it was a very badly done study, and that a lot of the women in this study had only taken hormones for maybe a week or 2, or even a month. And we know that one of the biggest risk factors for Alzheimer's is hot flashes. Who tries to take hormones? Women with hot flashes. So it was the study group more than the hormone therapy, and the Menopause Society has come out very strongly in saying this study changes nothing. And the devil's in the details. I do have a podcast episode on this because it's kind of complicated and it's important to understand.
Gotcha. And there's a new study about the cost of pickleball injuries.
Yeah, pickleball.
Yeah.
$400 million estimated cost in injuries. It is the fastest growing sport with over 20 million Americans now playing pickleball, 20 million and one, including me, because I'm learning. But it is a little scary because the injury rate is high. So specifically, what are we looking at? Well, first of all, it is an older population. We know that 1/3 of the people playing pickleball are over the age of 60, and a lot of them aren't in such great shape. But the number one injury is wrist injuries. Why? From people falling on an outstretched arm and then they break their wrists. Also, we're seeing a lot of sprained ankles, a lot of muscle aches. So these are the tips from the pros. Number 1 is do some warm-up before you do this. Number 2 is invest in some decent shoes, because we know a lot of these falls and a lot of these problems are because people are just wearing whatever sneakers have been in their closet for the last 20 years. Go and buy some decent shoes, like the kind of shoes you might use for tennis. So yay, I always love an excuse to buy new shoes. So I will be doing that. And then listen to your body. You know, if something hurts, and they're getting a lot of lower back strain from people bending over and stuff. If you have a problem, stop, ice it, see what you're doing wrong, because it's fun. It's a good game, but you don't want to get injured.
You done that pickleball? Well,
Was that how that happened in pickleball?
I feel like that's something I might be able to do, Larry. You think, would you do it, or is it?
Doubles? Are you thinking that?
Hey, I think we should all get out there.
Come on, Larry.
Yeah.
I did buy some paddles. I'm willing to share.
All right, I'll take you up on that.
All right.
In about 6 months.
Yeah, all right. You can check out Dr. Streicher on social media. Thanks again for being here.
Thank you, Doctor. Time now for Ron.